You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the
About
end of their life.
700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support outlawing.
You're a physician, right?
I am. Have I said that I support outlawing anything?
Senator John Kennedy thought he caught Yale Public Health Dean Dr. Megan Ranney in an easy trap on gun control, but she immediately turned the tables, proving that he brought a plastic spork to a gun violence data fight. Look, we all know how these Senate Judiciary Committee hearings usually go. Certain politicians show up with zero intention of actually learning anything or solving real problems. They just want their 5-minute viral clip for cable news. Senator Kennedy gave us a classic example of this. He tried to grill a top medical expert using cheap gotchas, completely ignored the real data she brought, and ended up dragging the whole conversation into this bizarre reality where he's comparing assault weapons to French fries.
Why do you think that Chicago has become America's largest outdoor shooting range? Do you think it's because of Chicago citizens who have no criminal record, but who have lawfully a gun in their home for protection or perhaps for hunting? Or do you think it's because of a finite group of criminals who have rap sheets as long as King Kong's arm?
So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me. Let me ask you this. In September of this year, our New Mexico governor issued a public health emergency order, and she suspended the right to bear arms in Albuquerque and the surrounding county. Do you support that?
I do not. What I do support is the work that New Mexico has done
with... Do you support that?
No.
You don't? Okay. Let's see. During his first 2 years as the DA in Philadelphia, District Attorney Krasner dropped 47% of all the illegal firearms cases in the city. Do you agree with that?
I'm not a lawyer. I'm a physician and a public health professional. I can say that New Mexico has done amazing work in trying to address the suicide and partner violence.
I'm asking about Philadelphia.
I don't have an opinion.
The DA dropped 47% of all the illegal firearms cases. Did he do the right thing there?
I don't have an opinion. However, I will say that just as with fentanyl, the spread of illicit substances...
I'm sorry to cut you off, but I'm
That's
running
okay.
out of time.
Understood.
The LA District Attorney, George Gascon, said that he would not prosecute any sentencing enhancements for guns or gang-related activity. Do you think he did the right thing?
Again, I am neither a lawyer nor a prosecutor.
You don't have an opinion on that?
I honestly don't know enough about it to have an opinion.
You don't think gangs should be prosecuted for having illegal guns?
I'm neither a lawyer nor a prosecutor, and that's not my area of research.
But yet you want to take guns away.
I've never said that I want to take guns away.
From law-abiding citizens.
I think that you are saying something that I've not said in my written or oral testimony, sir.
Okay. You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, Gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the
That's
end of their life.
700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support
You're a
outlawing.
physician, right?
I am. Have I said that I support outlawing anything in my testimony today?
Okay.
Kennedy starts off with the classic conservative talking point, Chicago. He basically asks Dr. Rani, is the gun violence in Chicago caused by law-abiding citizens, or is it repeat criminals? It's a complete false binary, meant to force her into a box and ignore the bigger picture. Dr. Rani didn't fall for it. She gave a calm, evidence-based answer. She explained that urban gun violence isn't just one simple thing. It's driven by super easy access to firearms mixed with systemic issues like poverty, lack of educational resources, and neglected neighborhoods. She even pointed to real studies showing that when cities clean up abandoned lots and repair broken buildings in these areas, gun violence and stress levels actually go down. That's what real public health work looks like. Tackling root causes. But Kennedy didn't want to talk about investing in communities, so how did he respond? He just waved his hand and dismissed her entire scientific explanation as word salad. Basically, if the facts don't fit the soundbite, just pretend they don't make sense. When he realized the data argument wasn't working, Kennedy immediately switched tactics. He started throwing specific Democratic legal policies at her, asking if she supported the New Mexico governor temporarily suspending gun rights in Albuquerque. Dr. Rani plainly told him, "No, I don't." So he pivoted again. He brought up the Philadelphia district attorney dropping illegal firearm cases and then asked about local prosecutors in Los Angeles. At this point, Dr. Rani had to stop him and remind him of the obvious. I'm a doctor and a public health researcher. I'm not a lawyer or a prosecutor. Kennedy was visibly trying to force a medical doctor to act as a defender for every progressive prosecutor in the country. And when she explicitly stated that she has never advocated taking guns away from law-abiding citizens, his main talking point just evaporated. The whole image he tried to build of her as some radical anti-gun ideologue completely fell apart. So, back to the hearing. Dr. Rani had previously mentioned that gun violence functions like a public health crisis, much like chronic diseases. Kennedy thought he had her here. He pointed out that heart disease kills around 700,000 Americans a year, while gun deaths are around 50,000. And then, and I am not making this up, he asked her if we should outlaw fried foods because they cause heart disease. It's the classic hamburgers kill people too argument. Dr. Rani quietly pointed out that she never said anything about banning guns or fried food. But just think about how absurd that comparison really is. Nobody is walking into a grocery store or an elementary school and causing a mass tragedy with a box of fried chicken. Heart disease is a serious health issue, but gun violence is an immediate external threat to public safety. Comparing the two just to avoid talking about basic background checks is absurd. After the fried food argument flopped, Kennedy basically gave up on interviewing Dr. Rani altogether. He turned to a completely different witness on the panel just to chase a dramatic moment. He brought up a comment that witness had made about how people shouldn't be judged only by the worst thing they've done in their lives, which is a pretty standard idea when you're talking about criminal justice reform and rehabilitation. Kennedy immediately jumped to the most extreme scenario possible, asking if violent rapists shouldn't be judged or punished. It was a total derailment. Nobody was suggesting that violent crime shouldn't carry consequences. Holding people accountable and believing in rehabilitation can exist at the same time. But Kennedy wasn't trying to have a serious debate about the justice system. He was just reaching for fear-based sound bites to end the clip on. At the end of the day, what happened in that room wasn't a serious policy debate. It was a performance. You had a world-class expert offering actual data on how to save lives by focusing on community investment, poverty, and reasonable safety measures. And the political response was to mock the science, dodge the topic, and compare firearms to fast food. If we're ever going to address gun violence in a real way, we have to listen to the evidence and treat it like the public health issue it is. Let me know what you thought of Kennedy's fried food line down in the comments. Drop a like if you enjoyed the breakdown, and I'll see you in the next video.